It's like,
Where's the disconnect? Why does like everybody else say it should be this, but places like that say, oh, you're fine and brush it off?
well, because all the studies that have been done, they haven't done enough research on it, but they have certain levels where, like, the FDA says, okay, it's medically necessary. If you have hypogonadism, which is the low testosterone, you have to figure out where it's coming from. If it's, adult onset, if it's from a testicular injury, there's a lot of different causes. Then you have to look at levels. If it's below a certain level, they'll treat it because it's FDA approved and they can get the prescription approved. That doesn't mean it's optimal. Most guys, it's going to be from 700 to 1,000 optimal range where they're feeling good. Women's hormones too. They never want to put them on anything because, the risks are too high. But if you think about it, we're putting something back in our body that it always has had. They always, blame it all on the hormones when these aging women had histories or comorbidities, that kind of thing. In men, testosterone can lower cholesterol levels, increase energy, increase muscle mass, all that stuff. There's a lot of good aspects to it.
Where's the line between what's medically necessary, the point of like lower than this, and why are we not trying for optimal?
The FDA says that it's not needed, but yet everybody's different. One man may feel great with a testosterone level of 400, throw a number out there. Another man will feel like crap, no motivation, depression, slower recovery times, no libido, no interest in sex or anything like that. It's very, I may have an estrogen level of, I'm just throwing a number out, 32. You may have like 69, and you may be on replacement, but I don't feel like I need it. It's very patient-centered, very individualized. And you go up slowly too, so you can see where your sweet spot is. It definitely is a process and a commitment because you see where your sweet spot is. I can say, hey, you're up to 550 and he could be feeling great. Okay, well, we'll continue that dose. And then, you can take a vacation from it, a couple weeks to a month off, and then go back on it once you start to have the symptoms again. It's just personalized. That's why, the FDA has these certain guidelines that if you fall in that, you don't get it. It's not approved. And a lot of, women and men both suffer because of it.
Are there long-term consequences of living with your hormones maybe lower than they should be, especially when you're like early 30s?
We'd have to determine the cause. So first off, a gentleman comes to me and he's got a testosterone of 290. I'm going to look at his history and make sure there was no injuries. We want to check for pituitary tumors, those kind of things, and see what's causing it. As we age, the levels automatically decrease. But if they're young, we would look at the primary cause.
How long have you been doing nursing?
I've been a nurse since, 20 years. Yeah, 20 years. Yeah.
Have you seen any difference in trends or patterns that you see in the office?
Oh yeah, for sure. I mean, even me with like hormone replacement, the more you learn about things, the more you're open to them and researching them. But as far as healthcare, absolutely. I feel like it's more of a business. It's not actually caring for the patients. Everybody's rushed, overworked. I feel like a lot of healthcare providers are burnt out. They don't want to take the time with the patients. Yeah. And people are a lot sicker. My son works in the ER and I feel like he gets a lot of sicker patients because, they don't have access to primary care, or they don't follow up on their screenings. They're not practicing preventative care and being proactive about their health. I worked in the ER for probably 6-7 years of my nursing career, and I've never had as many codes and all those heart attacks, strokes as he had. Yes, we had them, and it can depend on the geographical area, the population, if it's more elderly, but it seems like a lot to me, and the root cause is probably because they don't have access to healthcare, or they're, not active in it, and it's not a priority.
What are some preventative health practices you recommend people?
Blood pressure screenings, at least yearly labs for your lipids and cardiovascular health, blood sugar, diet. You want to make sure that you're a healthy weight and you're physically active. For women, mammograms, pap smears, over 65 bone density scans. Yeah, sleep apnea, because that's a lot that can cause hypertension, you have the fatigue, the weight gain. All those things are connected that people don't realize.
What would you say to someone who maybe started testosterone treatment and they have been there maybe, let's say, 2-3 months and they're not feeling any different?
Well, I would look at the dose. Usually it can take 2 to 4 weeks to start feeling it and experiencing it, and it's different for everyone. Somebody might feel great the next day. So monitor labs, see if it's going up, and then there's alternatives. There's boosters that they can take. There's certain vitamins and supplements. HCG is one of those. Those kind of things can all be added and go into the whole evaluation. I'm not a provider that's going to say, hey, you want testosterone? Okay, I'll send it in here. Give me my money. I'd rather actually take care of the patient because other things could be going on.
Yeah, there's a whole pharmacy at home. So in my view, this is easy access, but you're crashing your system.
Well, and it's important not to start 3 or 4 things at once. Then you don't know what the one is doing for you. You can't measure it. Even when I get a new patient for a male for testosterone therapy, I get a whole panel of labs. I'm looking at just their basic labs, their estrogen levels, the sex hormone binding globulin. That shows, if that's elevated, you're not using all the testosterone that you have. So you may be having symptoms, but his testosterone looks decent, but it's not available in the body. He's not getting the same effects. That's another reason why, one person's 500 is another man's 200 individualized. The sex hormone binding globulin. If that's elevated in the body, less of the testosterone that your body's producing is available. Say you have gas in your car but there's a clog or something in your fuel injector or something and it's not working. So you have gas in your car, but your fuel injector is not pushing it out. There's a lot of different things to look at. Even when I started learning about all this and became interested in it, it's oh wow, I didn't know that. Because I would have in primary care tons of guys come to me, prescribe testosterone. No, we don't do that. We'd send them to urology. Now I'm why didn't we do it? But a lot of primary care providers don't like to do it because they don't specialize it. They're not familiar with all those things. So they kind of stay away from it.
To me, something surprising was hearing people say how little sex education healthcare providers get. How are you a doctor and you're not getting education? That doesn't make sense.
Yeah, I was educated on all the hormones, going further and educating myself and doing EUs and different virtual programs and just reading books and listening to podcasts. I've learned so much in the past 7-8 months where I'm oh wow, why didn't I do this before? When I started on my own, direct primary care and the weight loss, I found that so many of my patients, even the women, coming in for weight loss, where I'm I could give you the weight loss medication, but your problem might not be that. It might be all hormone related. I would like to check that first instead of just putting a Band-Aid on a problem.
A few healthcare providers saying their recommendation is talk to your doctors, ask them questions and whatnot. But my problem is if the doctor is not well trained, if the doctor doesn't get training specifically about sex topics, then they don't ask you. They don't know you as a patient. You don't know what you're living with it to give us this life. If the doctor doesn't know what to ask, doesn't even feel comfortable asking. I have never had a doctor asking me anything about my sexual health.
Really?
Nothing at all.
I feel if someone broaches the subject, even with me as a provider, if I didn't know the answer, I'd be well, I'll look into it, I'll research it and see if I can help you. I had a gentleman that suffered with Peyronie's and he got basically disregarded and kind of oh, well, just do this. The physician or the provider didn't go any further. I bought books and I'm reading about all this stuff for him. The best way to explain, I think, hormone replacement therapy is kind of like a puzzle piece. Everybody's different. Not one patient's going to be exactly the same as another. It's interesting. It's fun. And all patients are different. Some are shyer. Some are listen, I feel this. I want to have sex again. This is not me. Others are oh, I have hot patches, people's different level of comfort. So, but you can definitely tell the difference when they're having good results and we get them optimized. I've seen my patients even with skin changes, mood elevation, they just feel like their normal self.
But to me as a provider, even if somebody the patient doesn't bring it up, if you ask the questions, you're giving them permission to bring it up.
Absolutely. Yeah. I always ask, what is the biggest symptom that you're having that's affecting your life? Is it the fatigue? Is it that you just don't have any interest in sex? What's the top one? And let's deal with that first, and then we'll see what can help with everything. Most of the time with hormone replacement, it helps multiple symptoms. I feel like so much can be related to your hormone levels that it's like, okay, well, let's try to get you optimized. I always tell my patients it's a process. Let's see if this works for you. If it doesn't, okay, well, we'll try something else or dose adjustments. But I definitely like to keep a close monitoring on them.
Let's say like maybe sex is not top of the list. Once you take away the things that are making them uncomfortable in other areas, then sex can become a priority because then you don't feel so gross out with your own body.
Yeah, then you feel better. If you're rested, you feel motivation to get ready in the morning or to go be social and do things. Of course, that all spills into your sexuality. If it's painful and uncomfortable, or you're just too tired to do it, or you have mood swings, you're not going to want to. When you get optimized, then you're more likely to go back to your old self and enjoy that.
So outside of hormones, what are other things people should be checking? Especially how do they impact sexual health?
Cholesterol levels, you're not eating a healthy diet, overweight, increased energy, that kind of thing. I think you need to really pay attention to, obviously, your urinary health, like genitourinary, arthritis, all those kind of things. Like if you have pain and it's not controlled or not managed, all those things are going to lead to you not wanting to have sex. Mental health is a huge one because if you're depressed or you just have high anxiety, you're going to have other things running through your head and you're not going to be able to calm yourself and relax and enjoy. There's so much. Physical health, anything that would debilitate and you not have the energy to do it. But I think mental health more goes cohesive with it, because if you don't feel good about yourself and your health and everything's not in place, how can you feel comfortable with someone else and actually enjoy each other?
So you had some experience in pain management?
Yeah, my first 2 years as a nurse practitioner, I worked for an interventional pain specialist, and it was very interesting. It wasn't like one of the run-of-the-mill pill mills, very reputable. I learned a lot as far as like different treatments, joint injections, massage, other conservative measures to manage your pain, different therapies, massage therapy, acupuncture, all those kind of things. And, medical marijuana. We didn't provide that, but I am a proponent for that because I feel like keeping patients away from narcotics and opiates is the best route. So, yeah, it was definitely a good experience.
Are you able to offer cards here?
No, unfortunately, we are too close to a school that we're not allowed to do that. So legally, no, we cannot. There's a lot of stigma around it, even though so many states have legalized it. It can be such a great alternative for anxiety, pain, people that have comorbidities, cancer, that have no appetite, it can stimulate that. There's a lot of good uses for it. I don't think I've prescribed an opiate since I worked in pain management. Some people that unfortunately have such chronic pain that is kind of the last resort. No, I would never recommend. I would always try to do conservative injections, different procedures, different therapies, and try to keep them open to all things. If they're in that much pain, then there's something else that needs to be done and they need to see someone else.
You need the medical marijuana, but then you can just go and get Delta. But then Delta has its other nuance to it. There's a lot of gatekeeping, but then humans always find a way around it.
The Delta, I think more will use for recreational use. Obviously, kind of getting around everything. I don't think I'd put anything into my body that, I didn't know was safe or, managed by a provider. Yeah, I wouldn't do Delta. I've had, when I actually worked at a treatment center, detox. Even the kavas and stuff, like bad effects. I mean, if you do it in abundance, overuse, those kind of things, you never know what you're getting. The stuff from the gas station, you don't know where it was produced. We did CBD in my pain practice, where we had a company that we promoted their CBD and offered it to our patients, but at least we knew the statistics, how it was made, where it was manufactured, what you were getting, rather than just picking something up off the gas station. Another thing people need to really be careful of, even with the CBD, drug testing that can pop up THC, because there is a small, tiny amount of THC in those products. It has to be below like 0.08, or I don't remember the exact number, but yeah, I would want to make sure it's reputable. And if it's being managed by a physician, I think that's a good thing.
I do think a lot of people will like put stuff in their mouth without understanding the potential consequences of it. And like, I met so many people like, oh yeah, I smoke weed to sleep. But it disrupts your sleep. That's why you're not sleeping well and you're not dreaming. And when you're off of it, your mood gets all crazy and you start having weird dreams or nightmares. I'm all up for getting high, but you should know what are the actual, because people think, oh, I smoke weed and it's easier to fall asleep, but it's not really fixing their sleep issue because they're not getting restful sleep.
The same with alcoholics. They think that they have to drink to go to sleep, but actually alcohol totally disrupts your rest. You're not really getting that full REM sleep, and then you wake up, and it's usually wake up early, but you still have those effects. You're not fully rested. And they have to keep on continuing that cycle to self-medicate. And that is another thing too. I don't know what the right answer is to that, because I mean, I don't think it's really, I guess you can become dependent on it because it can manage your symptoms. I've seen people with anxiety that just cannot go without it. But if you're looking at whether to be on benzo to manage your anxiety and your stress and panic, compared to marijuana, you know, if you come off marijuana, you're not going to die. It cannot, you know, if you come off benzos and you withdraw with no medical treatment, you could die.
I did not know that.
Yeah. Benzos and alcohol are the worst.
Okay. Do you see that's another thing people don't know about? If your psychiatrist gives you medication, you take it because your psychiatrist gave you medication. Like, they're the ones that know. But most people do not take the time to say, hey, I'm giving you Adderall, you need to be mindful, make sure you're eating.
Yeah. Watch your heart rate. If you start to have palpitations, like, when's your dose?
Take it early, but also don't take it so early that you need to know when you need it. Most of us don't get it. The only reason why I know is because I do this type of work, but if not, I wouldn't know that. And people just like, here. So often when I have clients who I'm recommending, hey, go seek an evaluation for meds. These are the potentials, and if they give you this is what might happen. You should know what are the consequences of whatever treatment you're getting.
Yeah, and that leads back to healthcare nowadays. First of all, I feel like the biggest complaints I've heard and experienced, you know, you find a primary care provider and then you can't get in with them for a month, and then when you do, you get in with them and then they have 15-20 minutes to spend with you. How can you educate your patients on what you're giving them, why you're giving it to them in that little time? They're so tied to reimbursements, they need to see so many patients, meet a quota, and I don't want my patients to be a quota. It's not worth it. For example, my mom, she went to the doctor and, oh, you need to be put on another blood pressure med. I was like, what med did they put you on? I don't know. What do you mean you don't know? Did they tell you about side effects? Did they tell you about this? Did they tell you about that? She's like, I don't know. And I'm like, she's in Ohio, but it's like, and yes, you know, she could be saying, I know, but and like, it's very important, especially with, you know, older individuals, make sure they know, you know, what's going on, and make sure you ask 2 or 3 times, do you have any questions? Is there anything else I can answer for you? Is there anything else that's bothering you? Because it, you know, at the beginning it could seem like a lot for a provider to manage all those things, but at the end of the day, they'll be taken care of better and they'll need less and they'll feel comfortable with you. So when something does go wrong, you're the first person they notify, tell.
And for many, walking into a primary care provider is very scary. Like, so many people have like a block with that. Sometimes I recommend, like, can you just write things down? Because then they get there, they're like, whoop, mind blank, yes, and go out. I just want to be done with it. but you don't really end up addressing all the things that you need to address.
Yeah, exactly. And they skip past things, and then you leave the doctor's office and I forgot to ask this, then you have to wait another month and a half to get back in to see them. And then sometimes, especially, I notice I'm from the Midwest, and in Florida it's so transient. I mean, I feel like providers leave jobs all the time. When I grew up, I had the same pediatrician for 17 years. Like, he took care of my whole family. He knew me. Nowadays, it's not like that. You may go see someone and then the next week they'll be gone, or you'll be seeing their nurse practitioner or their other nurse practitioner. The pain practice, I think each physician had 2 NPs or 2 PAs, so it's like, you're going to see that day. When patients want to see the same provider, they want to have a relationship with that person. They want to know that they know what's going on with them.
And I feel like it is a relationship.
Partnership, because I can't make them do what I want them to do with their body. But we got to meet each other halfway. We have to compromise. We have to work together to get the best results. You know, there's patients that do not like taking medicines that, okay, well, so let's research holistic options. Let's see what else we can do until, like, really need to put you on a medication for this. We'll, start off with the least amount of intervention to solve the problem. Even with diabetics, or if their cholesterol's high, diet changes, exercise, all those things. Type 2 diabetics, we want to lower the sugar, lower carbs, monitor those things. But if they're not educated, they don't know what things to do. And a lot of times, doctors just hand them the pill. And I don't know why I take this. I've heard that so many times. If I had a dime for each time, I'd be a millionaire. He just told me to take it. I don't know what it's for.
Viagra, you took it didn't work. Okay, so what did you do that day? Yeah, so we went to dinner. I had a freaking fatty, full dinner. And then the Viagra didn't work. Yeah. Oh no, there's something wrong. Yeah, you're fooling yourself with fat. The Viagra can't work well now. But if your doctor never told you, you wouldn't know. Yeah. I didn't know that until somebody described it. I'm like, okay, so why? So luckily I wasn't supervision, so I got the explanation. But otherwise, we all think like Meet the Fuckers. I love that movie. Maybe it wasn't the first one, Meet the Parents, and he takes one, it's like up for 4 hours, so we gotta go to the hospital. And we all think that if you don't receive any education, you think like you take Viagra and automatically everything's up, you're good, go ahead, you don't have anything to do anything else. But if you're not changing your diet, if you're not changing all of this, and interestingly, when you start having erectile dysfunction, you have a higher risk of having a heart attack later.
Because it's blood flow. I mean, that's what an erection is. So you're more at risk. Yeah. I mean, some medications don't work for some people. They have to take a daily dose of sildenafil, which is the Viagra, as opposed to being able to take it just once and having that sweet spot. Or tadalafil, which is this like Cialis, and that has a longer half-life lasting time, a bigger window of time to have sex and see if it works and it lasts longer. So I mean, there's different options.
The question is, how likely is the person to go back to their doctor, especially if they're already uncomfortable with the topic?
Oh yeah, no, they're not gonna. No. And even I think if they did, get the Viagra and it didn't work, yeah, I think they would be less likely. Absolutely. I had a patient, sweetest little old man, this was years ago, but he would always come to the doctor with his daughter, and his wife had passed away years ago. And so whenever his daughter was there, he was always like, ugh. I'd ask him, is there anything else you need? And finally came in one day without the daughter, and he's like, Jennifer, can I have this? I'm like, yes, you can. Don't tell my daughter. I'm like, okay.
Don't bring it up.
Don't bring it up. I'm like, all right, I won't. But I mean, there was another, it was like a Grey's Anatomy episode where the kids had brought the dad had come in to get a penile implant, and the kids came in and tried taking over power of attorney. Like, you don't need that. You can come live with us, Grandpa. And he's like, hell no, I'm not coming to live with you. I want my pump. Like, give me my pump or my implant or whatever. And but that was great. Yeah. But a lot of people don't talk about it. It's not televised. It's not. And you get the commercials with the Cialis where they're holding hands in separate tubs. It is the worst commercial for intimacy or anything. I mean, first of all, you're in your own little containers, separated, just a hand. Like, that's for erectile dysfunction? What? Like, I'd probably want, if I was a guy, I'd want it to be like the guy jogging, like getting ready to go out.
But in him, they're putting very young guys. I'm like, if you're in your 30s, early 30s, they don't look past 35. Maybe let's find root cause.
Alcohol can be a huge cause. Stress, anything blocking, like psychological, that kind of thing can totally have an effect. One of the tests you want to find out, does your patient have morning erections? Do they have, what is it, nocturnal? Now I can't think of the name of it. Where, yeah, they can get erections at night while sleeping. You can do the little test where you wrap the paper around it and you can tell if it's broken. But that will tell you if it's physical, medically a reason, or psychological. It kind of goes back to like the anxiety stuff. What came first? Your anxiety or your shortness of breath? Are you anxious because you're not feeling well, or are you not feeling well because you're anxious? Kind of like the same thing. You have to like look at the big picture and not just give a pill.
And we separate them for ease, but there's not true separation in the body. This is what's happening, and this is it's a feedback loop.
Absolutely. So, yeah, and if people aren't looking at that, they don't know. Just like the weight loss patients. Well, maybe it's your hormones. Maybe this weight gain started, and like you said, you're doing the same things, still exercising. You're not losing the weight like you used to. You're not this and that. I don't want to put a Band-Aid on it, which I could, and we may still do medical weight loss if you're still not having the results you want, but optimizing those hormones and going to the root cause is the best way.
You mentioned alcohol and detox. Have you worked with addictions? What's your experience?
Not too much. I worked for about 7-8 months in a treatment center, in a detox center. We would detox benzos, heroin, alcohol, everything. We'd have patients, like I said, I had one that was the kava.
I didn't know that.
I didn't either. But, in retrospect, you're looking at that and you don't know how much is too much. You don't know what you're getting when you're buying from gas stations.
Easy access.
Yeah, and you don't know what's causing what. You don't know, past mental health history, those kind of things. Yeah, it was heartbreaking working in that area. Especially because you get invested with the patients and you really want them to succeed. And while they're there, it seems so good, but being out in the temptation and seeing people come back, it took a toll.
Is there something close to that you still see now?
No, I don't currently have any that I'm like managing or anything like that. I don't offer like Suboxone or anything like that at the moment. Would I consider it? Maybe. I just don't. I feel like it's specialized, and that's another area of medicine too, where there's clinics and they're just handing out those things. I feel like they can be abused too at the rate where if they're on those medicines and they use, potentially die. It's very, touchy.
The part that I have worked with is sober sex. They're not using anymore, but then they're having to have sex when they usually, before they did it, either drunk or high on something. And now all the self-image, maybe even trauma and all the things are coming up. I cannot get aroused, I get anxiety, I cry after I have an orgasm, all these things. Is there anything that you could speak about that? Even having fun, it becomes like a relearning thing, because you're used to go out and drink something, and now maybe you don't even trust yourself enough to step outside of it.
Yeah, you are getting to know yourself all over again, and the real you, because obviously I think when someone's dependent on a substance, that's not the real person. It kind of takes over everything. We would have a lot of patients that would intermingle too.
Well, what else are you gonna do?
Yeah, what else do you do? But because it's a healthy outlet, and when you find someone you trust and you have that relationship with and that intimacy, it's a good thing. It's all natural. You're not going out looking for a high. But I feel like they have to do a lot of work on themselves before moving towards that.
Stress and health. Do you see any difference when patients are actively in therapy or some kind of life coaching or something, some extra support in combination.
Oh, I feel like it does wonders. A lot of people don't have the resources, the money, and that kind of stuff to do that, but it does wonders because you're from all aspects, especially when your providers can work together and communicate. Yeah, stress, it's horrible for your health, for your mental health, your physical health, because once you get in that point, if you're depressed, no motivation, you don't want to get out of bed, you don't want to do anything, you're not your normal self, you're moody, people are asking you what's wrong with you, and you don't want to explain it. A lot of people are very closed-doored about those kind of things. They don't want to admit that they're having trouble. And I feel like as a provider, you got to observe what is your patient's normal affect. How are they? Are they normally happy? You need to be able to see if there's a change in someone or if something's going on, even if it's not in their life. Oh, how's your family? How's everything going on? How's work? How's this? Helping them manage the stress levels. I'm not a therapist, but I try to give as many suggestions to, decrease those situations, and always recommend therapy. Always recommend, even if you can't afford it, then find a friend that you can talk to. Find somebody that you're communicating with and letting them know what's going on, even if it's just to get it off your chest, off your shoulders, because you feel so much better. Nursing and in healthcare, like if we'd have a rough day in the ER, if we had a death, especially when I worked in HEMOC, we would do debriefing just so we could talk about, first of all, how we cared for the patient, what we could have done better, what if we missed something, what we did great, how it's affecting us, so we could all support each other to move past that. So I always tell my son, I come home from work, I'm like, just give me an hour, because I have everybody else's things on my mind. I need to woosah. But it is because you're busy caring for everybody else. Everybody else is doing that too. Everyone struggles. Stress does have a huge effect. They'll start eating bad. They won't want to exercise. I didn't get my medication. Oh, I don't need to go get my mammogram, whatever. I'll put it off till the next month. Things just get buried. And then people get overwhelmed, and then they come in and they're like, well, you need this, and they don't want to come back again. And you have to make time for self-care, your mental health, but a lot of people aren't. So I feel like that definitely affects their health all over.
What did you see? So working in the ER, that's very heavy work. What do you see in terms of the quality of the healthcare providers, and how a heavy work day can affect it, like you just explained, the way that you care for yourself, and you don't have more energy to also go home after a 12-hour shift and make yourself a meal. All of these things that kind of compound. What do you think is needed for the healthcare provider community so we can take better care of them?
I mean, definitely more support. My son's an ER nurse now, and I tell him, meal prep, make sure you have something to eat. Even if you're busy, stop and eat. Don't wait 12 hours and then, go home and pig out. Those are bad. Those aren't healthy habits. Sleep deprivation. People don't sleep enough. They'll sleep 3-4 hours and then go back to work too many days in a row. All those things can affect your well-being and your health. You become overweight, increased blood pressure, the stress, the anxiety. You're always putting yourself on the back burner. My patients do it and providers do it. I think we have some excellent providers, but I feel like a lot of healthcare providers nowadays are overworked. We've always heard about the nursing shortage and patient to provider ratios, and when you have 6 patients at once and all of them need something, a huge stress keeping up, and you're liable and you care, and it's very difficult. It can definitely put self-care on the back burner, especially eating, everything. People go out and then they go to alcohol. Oh, after work I need a drink. And not to say that a drink occasionally isn't fine, it's okay, I'm not downing that, but it could become a habit. You need to realize how it's affecting your life, your habits, and your relationships with others.
I was in a few business owners making a joke like, oh, becoming an alcoholic, because they're like, I think we have glorified the professional, powerful woman who comes back and gets a glass of wine, but then the glass of wine becomes 3 glasses of wine, and before you know it, you're every night drinking a glass of wine because it has your weight on wine. And okay, fine, but is that your only way? because then you're not actually allowing your body to regenerate.
Yeah. People use that as it's my unwind. I think it's more of a wind you up. And like I said, I don't think it's bad, but if it's a habit, then if you can't go without it for a month, then there's something wrong. If you can't go without it for a week, there's something wrong. It's not a way to cope with the stress, especially with work, because it's just gonna cloud your judgment, make you less focused, make you less sharp with what you have to do. It's more of a hindrance. It's definitely balanced. And even relationships, people that do shift work and healthcare providers, their relationships suffer because one partner may be working 9 to 5 and the other's working 7 to 7 at night. You have different sleep schedules. Well, how do you schedule your intimacy? How do you throw that into the mix? Because you need that too to feel good and feel normal. You can't just keep going like the Energizer Bunny without, expecting to crash.
When people have good sex, the next day they're actually more productive. They're better at their job.
Oh, yeah. I mean, they're just happier all around. It's good medicine. But, yeah. But if you are working so hard and you're not making time for that and your schedules aren't lining up or you're not practicing self-care and you're gaining weight or you just feel like, you're not going to want to do it. So all those things, it's all connected.
And how often will your employer, let's say you work at a hospital, how often will your employer, hey, how's your relationship?
No, they do.
Considers it.
I think the last time I worked for a hospital system, they did provide, to have 4 visits you could see a therapist if you were having issues. And I know there are different programs for employees, if they're suffering with something, whether it be alcohol, relationship issues, health issues, those kind of things. But a lot of times, first of all, people might be too personal. They don't want to share that. They don't want to admit that they're struggling. Maybe being able to have access to those programs is difficult with your schedule, your kids, your, all your commitments.
And they're worried you're gonna somehow tell.
Mm-hmm. Yeah, that too. Especially with nursing, I would think you don't want people to know your business, especially if you're struggling with addiction or anything like that. You don't want to put it out there. Burnout is a real thing.
What's the point where you would say people should be going to therapy, counseling, coaching, whatever that is? Where's the point, where's the line for you as a provider that you're identified, not just talking to a friend, but when you feel you need professional support?
I would recommend it before someone even started medication, just because healthy coping mechanisms, especially for anxiety, like deep breathing, breathe in 4, hold 7, breathe out 8, those kind of things, may be able to manage. If they can't manage with that, then I would recommend going to see a therapist. Even if you're not seeing someone every 2 weeks or every week, at least you have someone form a relationship with them, because then you can check in with them if something does happen in your life, because we don't plan to be anxious. We don't plan to have these monkey wrenches thrown into our existence. So to have somebody lined up that if you need them, you can go see them and they know you have a relationship with them. And after that, them working with, your healthcare provider, to come up with the best plan. When I worked at Walmart Health, I had a behavioral therapist there, and we would work together with patients, and what she would recommend, and, as far as therapy, and we would, bounce back ideas about medications and which ones we thought would be best for that person. She got to spend more time, obviously, in a therapy session, with not getting out all the health information and that kind of stuff. It was really good to have that. We're coming at it from all angles, and the patient feels supported, knows that we're communicating. I think that's the best way to do it. But if I could go see a therapist every week, I would. I think everybody should, because you have that non-biased, you can say anything, you're not being judged, you're letting it all out, and you get to hear a different perspective and hopefully some solutions or some ideas that can help you manage.
Anything else you would like to share?
No.